I got many requests on my channel to speak about anterior pelvic tilt. Well, today is the day. We're going to talk about what it is, why it's a problem, and what we can do about it in a very structured fashion, because this is my, my brand. Welcome, I'm Olivier Girard, economist, posture therapist, author of the Posture Manual, and creator of 3 online programs. First things first, what is anterior pelvic tilt? Well, look, it's this, okay? It's often identified by the fact that you see a hollow back. But there's a trick. The trick is a twofold one. Number one trick, many people have some kind of a shape like this, but not only due to the fact that they have a hollow back, also due to the fact that they have buttocks that extend backwards. So if you look at the curve in the lower back, it looks hollow, but not everything is due to the shape of the spine. That's confusion number one. Confusion number two, you can have a hollow back due to other reasons than anterior pelvic tilt, and in particular due to the fact that your pelvis is positioned forward. Yeah? That doesn't mean that it is turned forward. So here we're really talking about this situation where, wow, to make things simple, you see a vertical alignment and a hollow back that is really in the shape of the spine and not only due to the shape of your buttocks. That is what it is. Now, why is it a problem? It is a problem because it is a violation of posture rule number 1B, CF My Book, or the online posture programs. Posture rule number 1B stating that when your back is hollow, you increase the pressure on the intervertebral cartilage and therefore speed up the pace and the severity of osteoarthritis, plus you create a lot of muscle contraction here in the lower back, plus as this is correlated with a pelvic floor which is relaxed, when you combine a hollow back with a physical effort, be it pregnancy or manual handling, sometimes CrossFit, the risk of incontinence increases. So I think the case is solid enough to wonder what we can/should do about it. Now I'd like to identify 3 major reasons why you have anterior pelvic tilt. Well, look, reason number 1 is the following. Stand with your feet parallel to each other, unlock your knees, put your hand in your lower back, and lock your knees, i.e. create hyperextension in your knees. And you see that immediately your pelvis goes clack and your back goes hollow. So knee hyperextension is the first reason of anterior pelvic tilt. Why do you have hyperextended knees? Well, because you have bad habits, because you wear high heels, or because you stand for too long in a row. For the 2 first ones, I won't say much right now, but I will say something on the 3rd reason, which is that you stand for too long. Obviously, trying to, if at your workplace, provide sit-stand stools or a chair can be useful, but there's a technique also that can be used to stand for prolonged periods of time without getting tired. It's the following. Instead of having your 2 feet at the same level, you put one slightly forward and you just let your body bounce back and forth. I call it the drunk man's technique. Is exactly when you're drunk, you just oscillate back and forth without thinking too much. And what you realize is that you're always on 1.5 feet. When I am backwards, the front toes are raised, and now the rear heel is raised. And I just go like this, and then I can alternate my feet and all that. And when you do that, you realize that automatically your knees will be unlocked. Now let's switch to reason 2. Reason number 2 is what I would call mass unbalance between front and back. In other words, if you have a belly that pulls forward, your back will hollow. This belly can be because you're pregnant or can be because you're overweight. And if we want to go into the, say, the physical details, it's not only the weight of your belly that will create the force that draws you forward. It's largely the weight, but not only. Imagine that someone has, say, a 20 kilo belly that is quite close to his body but going all around, versus someone who has a same 20 kilo belly but that extends forward. Well, probably the second person will have a higher tendency to hollow the back, because what matters is weight times the distance. What matters is the torque around the hip joints and the lower back joints that will hollow the back. In this case, I don't see too many solutions. I mean, if your belly is caused by pregnancy, Mother Nature is going to take care of the problem. It's going to take a couple of months, maximum 9, and with that, you're going to be solved. If you're overweight, well, losing weight is your only way out. And now let's dive into reason number 3, which is very much interconnected with all the other reasons, is what I will call muscle imbalance. What I mean with that is that when you use your body in a certain way, you will reinforce the tonus of the muscles that you use most. Okay? The tonus being, to make things simple, the strength of a muscle without you doing any effort. So kind of the passive force that it exerts on your joints. And if I spend my life like this, well, the muscles that hollow my back are getting more tonic than the muscles that flatten my back, and therefore there's a tonus imbalance that projects my pelvis in that direction instead of keeping it somewhere in the middle. And we need to resolve this muscle imbalance, one way or the other. Whether you lock your knees or whether you're overweight will always have as a consequence the muscle imbalance. So now question, what are the muscles involved? The muscles that are involved are those which hollow your back, which are the lower back paraspinal muscles, so the small muscles running along the lower back vertebrae, as well as the iliopsoas. The other couple of muscles that are involved are the lower abs, those which are under your belly button, going horizontally like this, as well as your glutes. Yeah, those are the two muscles that draw the pelvis the other way around. So guess what we need to do? We need to stretch and lengthen and relax the first family. We need to remobilize and strengthen the second family. In which order? Well, I would say both at the same time, but somehow the cursor will evolve a bit. At first, we should put the emphasis on reducing the strain in iliopsoas and lower back extensors, and little by little we can move to training the strength of the others. Why in this order? Well, simply imagine that you drive a car that has the handbrake on. Of course, you can accelerate stronger and the car will move, but you can also loosen the handbrake. And that will be less strain on the overall vehicle structure. Well, this is the same. You can see the tonus of the muscles holding your back as some kind of a resisting force to what's good for you, and therefore you lower the resistance before activating the engine. So now the two things that I need to tell you, and with that you'll be fully equipped to deal with anterior pelvic tilt, is how do I exercise the muscles that need to be loosened, and how do I exercise the others. We'll start with the lower back extensors here. The one thing I like to do first is to kind of remobilize them, i.e., you can imagine like you put chewing gum in the fridge and then you take it out. If you start pulling on it, well, it's likely to crack. The image is a bit dramatic. It's not like this for muscles, especially lower back muscles, but I think that step one is really to remobilize the muscles. And for this, the cat-cow happy dog is a great exercise. So let's look at cat-cow happy dog. In these exercises, I care more about muscle activation than about the amplitude of the movement. I want just to warm up the system, okay, to reconnect it to your brains also. The cat-cow thing is the one that most of you know, but many people don't do it properly. The basic variant is when you have your knees under your hip joints and wrists, elbow, shoulders vertically aligned. And the exercise starts in your pelvis when you inhale, and it follows in the neck into a hollow back. So you see I'm looking at the ceiling. And then when you exhale, you start in the pelvis and you end up looking at somewhere in between your knees. And you do this for a few times. Yeah? The variant for anterior pelvic tilt will just be that we open the knees a bit more, which will focus the exercise on the lower back. Okay? So we go like this, and we go like that. Hollow, and flat, then round. Of course, the amplitude of the movement is less, but that doesn't matter. Yeah, we don't care about the amplitude, but please, you do the movement properly. So this is warming up the muscles in one direction. Now, to warm them up in the other direction, we will do what I call the happy dog exercise. You're quickly going to understand why the nickname. We do the exercise with a flat back, and we bring the left hip to the left shoulder joint, and then same to the right. Okay? And the logic is the same. If we do this exercise with the knees open more than 90 degrees, well, the focus is on the lower back. Be careful when you do this, though, that you don't hollow your back. Okay? It should stay flat. So that means that you should already actually be engaging your lower abs, which is the beginning of strengthening them. So with these two exercises, you have remobilized the lower back muscles, and of course somehow the iliopsoas also. Now we're going to stretch the lower back, and the safest exercise I know, i.e. step one, is the following. Same, you know it all, but it's a great exercise, is you lie down on your back, you bring one knee to you, then the other knee to you, you make sure that your lower legs are horizontal, and you just hold it here like this for a minute or something. Okay, this is to be done several times a day. And after a while, what you'll do is the upper body reset, CF the card for more details, in particular the last phase of the upper body reset, which is when I do these movements and I bend forward. Here I'm working rather in the upper back and the neck, and to work on the lower back, I go around that level. No point to go lower, okay? You just need to be somewhere around hands at knee level. So here are three great exercises that you can do for your lower back muscles. And now we can have a look at the exercises that you can do for your iliopsoas. In this screen capture, you see the traditional version of the iliopsoas stretch, which works quite well. You can either do it at the end of the bed or on the side of the bed if you're lying down a bit diagonally. That works. Another variant is the following. It has pros and cons. I, generally speaking, don't like exercises which are standing so much, especially stretching exercises, because standing with precision is more difficult than lying down with precision. But the good thing about standing is that you can do it anywhere. The lying down exercise is not great to do, say, on the motorway or at work, but at least you can rely on the standing version. By the way, one thing which is important to understand about iliopsoas is that it gets shortened when you sit for prolonged periods of time. So it's really something that you should consider very seriously if you have a sitting job, whether it's an office job or a driving job. So let's look at the standing version. The standing version is the following. I'll have my 2 feet flat on the ground. Well, I don't know, there's around 80 centimeters distance between the 2 feet. And you see, I'm going to go like this. I'm going to flex sideways and just let my hand glide on my thigh. If you don't feel much, it's probably because you do the exercise with a hollow back, in which case it would be good that you do your best to tilt your pelvis and do the exercise with a flat back. There's a third version of the iliopsoas stretch that I've never showed on YouTube. I'll show it now, but you should never do this exercise if you have any sort of hip issue. Okay, whether you had just joint replacement or you have hip osteoarthritis or anything, without the advice of your physio/GP, you don't do what I'm going to show you now. I'm going to lie down on my back and I'm going to put the right heel under the left buttock. And now I'm going to take the left knee and just pull towards my chest. And that opens the right hip joint angle. So again, 3 exercises between which you can alternate depending on what you feel and depending on the circumstances. Now, what can we do regarding strengthening of the lower abs and the glutes? Well, this may sound a bit rude, but the best abs strengthening and glute strengthening that you can do is use them properly all day long. Yeah, i.e., as soon as you stand, make sure that you stand with a flat back, flat being just what you feel in the lower back. I'm not advocating for a back which looks like a plank. Okay, flat back is just a controlled curvature in your lower back. This is hollow, this is flat, and I know that I'm going round when I can feel the tips of the vertebrae protruding. So if I'm here round, I make the vertebrae just disappear, and this is flat back. And here, I'm definitely training my lower abs. This should become your normal posture. It will only work if the pelvis is slightly backwards, and to assess whether it's backwards enough, we have what I call the penguin test. You see, there are many animals in my stories. The penguin test being the following. If you stand like this, pelvis forward, and you do the penguin, as long as you hit your thighs with your arms, it means that your pelvis is too far forward. So pull your pelvis back, and when your arms can cross freely in front of your hip joints, then your pelvis is at the right place, and now you can rotate it, yeah, without shifting it forward, and that is training your abs. The day before yesterday, I was with the patient having a hernia with whom I was discussing this topic, and she was feeling super odd. Well, it's normal to feel odd because it's a new habit. But if you look at the charismatic celebrities that you see here, well, you see that they all have their pelvis back and their back flat. So you feel strange because you're not used to it, not because it's unnatural. Make the difference between unnatural, which is not good, and unusual, which is what you feel right now. So you see, being able to do this requires the mastery of the pelvic rotation. The cat-cow exercise was step 1 to learn this. Step 2 is to do cat-cow kneeling, which we're gonna do now. Without moving your torso, you go hollow back, flat back, round back, which is basically sitting on your heels. And again. Step 3 is against the wall, so you hold your hands and forearms like this on the wall, and you go hollow, flat, maybe a bit round, flat, hollow. And then little by little, you let go of the wall until you don't need it anymore to do the exercise. Your focus should really be on the fact that your pelvis doesn't move back and forth. And of course, if you want, I can show you 1 or 2 abs exercises which are safe for you. Let's go. If you lie down on your back, you'll see that your back tends to be naturally hollow. So you can see my hand here. If you bring your feet towards your buttocks, it flattens. So what is training your abs number 1 is I bring my feet a little bit further forward and I go hollow, flat. Hold it flat and bring the feet still a little bit more further. And I feel that my abs need to do more to keep this contact between the back and the floor. And even a bit further. Yeah? And now hollow, flat. So playing around with this trick is one first way to train your abs in a very safe fashion. Option number 2 is you extend one leg, make sure that your back is super flat. So you see I always go hollow, flat to say make sure that it's flat by making sure what hollow is. And right now, whilst keeping my back super flat on the floor, I'm going to raise the heel by just 1 centimeter. And this, if your back is flat on the ground, strengthen your abs a lot and let go. And if that's getting too easy, well, you do it with the other leg less towards your buttock. And now it's much more difficult, as you can hear from my voice. These are simple, safe, yet very effective abs exercises, which I honestly very rarely do apart for demos, because I don't need them as I use my abs all day long when I stand. But if you want to train your abs, this is what you can do. So conclusion, anterior pelvic tilt is largely due to muscle imbalance. But muscle imbalance is itself due to 2 things. Either your morphology, i.e. where your mass is placed, or your habits, which is how do you use the imbalanced muscles all day long. So bear in mind that stretching, strengthening, is just a transitory step, but it is not the solution. The solution is to change or usually your morphology and your habits. I can't do anything regarding changing the morphology, that's really not my specialty. But if you need help on changing the habits, I have the long posture program, either in the version with coaching or in the other version cheaper without coaching. And there you will get a 10-week progressive program that brings you from sitting to standing to bending down and carrying, in which we'll pay very much attention to this pelvic position, and this is the deep and the true solution to help you fix anterior pelvic tilt.